So, how many people are interested in the topic tonight? Weight loss. Who isn't, right? Okay. So, here's one thing I will tell you. And not to deter you. And maybe you've noticed this. Maybe in the last 20 years, have you noticed that it's more difficult for people to lose weight than it once was? Does anyone realize that? Yeah. And it is. When I first was in practice in 2000 to 2005, maybe 2010, I put someone on a lower starch, lower carbohydrate diet and get them on some protein, and typically they lose 30 pounds in 3 months, roughly, something like that, if they really stuck with it. Then I'd start to do that, and then someone would, and especially women over 40, especially women that have had children, they would have, it would be stubborn weight loss. They have a difficulty losing weight, even though they were eating properly. So we had to look more deeply into things. And so I'm just here to tell you, if you're having a hard time losing weight, even if you're doing some of the things that I'm telling you, you just have to keep going. You just have to keep going, because it's probably multiple factors that are causing the weight loss, or the lack of weight loss, the stubborn weight. So, if you have a weight issue, you can be certain that you have nutritional deficiencies, toxicity, and organ dysfunction. There's no question about it. So I want to ask you, the crowd here, why or what might be causing nutritional deficiencies? Maybe someone that wasn't here last week. What causes, and I can always answer if you're bashful, but nutritional deficiencies, why do you think we have them? Do you think we're getting all the pesticides?
Yeah.
Sure.
Our food's just not as
It doesn't have it doesn't have the nutrients that it once had, right? It doesn't carry the nutrition because the soil's depleted. Okay, did you want to say something?
I just want to say that.
You wanted to say that? Okay. I'm sorry, I took your answer, didn't I? I'll have to ask you another one next time, okay? Yeah. So, the soil is depleted of what, Nina? Vitamins and minerals. That's right. That's right. Not really vitamins. You don't get vitamins from soil, but you get minerals from soil. So you could eat perfect organic diet from produce from Heinen's, and you're still going to have nutritional deficiencies, because even that food, it might be cleaner, but it doesn't have the nutrients that it once did. So 100 years ago, when people used to rotate their crops, the soil was, nutrient rich. You would get the food, you would get the nutrients that you need. But back then, it was more hygiene was an issue. People were drinking dirty water, and they didn't know about how that would affect you. So anyways, that's how you're going to get nutritional deficiencies. Another way you're going to get nutritional deficiencies is eating foods that have empty calories. Cookies, cakes, candy, things that fill you up, make you feel good temporarily. They're not going to give you what you need. Okay, so toxicity. We talked about this last week. So we are living in a toxic environment. We are exposed to pesticides, herbicides, fungicides, pollution. We get toxicity from cosmetics, soaps, cleaners, detergents. They're spraying. You go to a hotel, they spray Febreze all over the place. They clean it with Clorox bleach. And especially since COVID, that we have to, what do you call it? You have to sanitize everything, right? Or you'll catch a germ. So, that's all toxic. Or Purell. But, too much of that stuff. I mean, that's basically alcohol, but, when you're spraying artificial stuff in the air, especially Febreze and Glade plugins and all that kind of stuff. And I told the story last week, but I'll tell it real quick. I had a lady who had a terrible cough, and the total problem was she was using Glade plugins and Febreze. We got her off that. I found pesticides and artificial fragrances to be a problem through my muscle testing with her. And within a week, the cough was gone. And she had been to this doctor, to that doctor, asthma test, breathing test, you know, you name it. So she was in that medical machine, and someone luckily told her about me, and we got that handled. So, how might toxicity cause stubborn weight loss? What gets stored in fat?
Toxins.
What's that?
Liver.
Oh,
Oh, the liver.
well, the liver. Yes,
Toxins.
toxins, that's right. So the body wants to protect us. So it's going to store heavy metals and chemicals in the fat cells. So, and if you don't take the proper supplements or herbs to get rid of those heavy metals or chemicals, they're going to stay lodged in the fat cells. So even if you eat a perfect diet, lower carb diet, to start trying to cause fat loss, what's going to happen is the body's going to hold on to that fat because it doesn't want to release those toxins, because the body's not equipped to get rid of it properly without proper supplements and that type of thing, okay? Or detox practices. So that is a major cause of stubborn weight loss. Not minor, it's major, okay? And that's probably the main reason, okay? Also, the body stores excess estrogen, and women do not need extra estrogen, okay? We are swimming in a sea of estrogen. Estrogen is pumped into a lot of the animal products, pesticides, herbicides, fungicides, industrial chemicals are often estrogen-like substances. They're called xenoestrogens, X-E-N-O, xenoestrogens, and they get stuck in your fat cells too, and they cause you to hold on to that fat, okay? And so there are certain things you can do to bind those xenoestrogens and get them out of your system, but you kind of have to know how to do that. And the body doesn't just freely get rid of them. And then organ dysfunction. Can someone name an organ or gland that might be not functioning properly that would cause someone to not lose weight? The liver? Sure. Maybe the liver just can't process these toxins, so you can't lose weight. What else? The thyroid, yeah. Thyroid is this gland in your neck, and when it's not functioning properly, it's your metabolism that keeps you going. It heats you up. It helps you burn food for energy. It's responsible for controlling a lot of that metabolism, basically. So that could be a problem. The adrenal glands could be hyperactive from too much stress, and they're pumping out a hormone called cortisol. Cortisol causes midsection weight gain. So you'll start to get a spare tire around the midsection because the body's trying to store fat as a survival mechanism. It thinks it's in chronic stress all the time, and it kind of is. How many people are living, the American dream? Go, 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 rush, rush, rush. Run your own business or have a job with kids and all that good stuff. Nina, you are? Yeah. Our 8-year-old over here. So, anyways, weight loss can be caused from nutritional deficiencies, toxicity, and organ dysfunction. Now, there's another thing that can also contribute to weight loss issues, and that's too much sugar. Okay? And sugar actually causes nutritional deficiencies and organ dysfunction. So how might sugar cause a nutritional deficiency? Well, if you're eating a lot of sugary foods, like I said earlier, you're going to have empty calories. You're not going to, eat the foods that are necessary to get nutrients. Okay? Sugar causes organ dysfunction because sugar is inflammatory. Sugar adds fuel to the fire. It adds fuel to the flame. So if you have pain in your body, gut inflammation, sinus congestion, chronic sinus issues, and you're eating a lot of sugar, it's just going to add problems. Okay? So some of you might be thinking now, Sugar, sure. Sounds great, Dr. St. John, but how do I stop eating this sugar, right? I'm addicted to it. Okay, well, I'm going to give you 3 tips for sugar cravings. Okay? So, would that be helpful? Okay, good. So, number 1, when you have a sugar craving, when do the sugar cravings tend to happen? All day. Okay. It could be, yeah. First thing in the morning, like, most patients don't wake up first thing in the morning and say, oh, I'm craving sugar, right? But usually like the afternoon when you have a little dip in energy, right? Or after dinner, I want something sweet, right? So, all right, drink a glass of water, wait 10 minutes. Set a timer, wait 10 minutes after that glass of water. Don't drink tap chlorinated water, some filtered water. Wait 10 minutes and see what happens. If you don't have that sugar craving, or if it greatly diminished, and you are dehydrated. And so that's a very common reason for someone to crave sugar. Number 2, eat animal protein, breakfast, lunch, and dinner. Especially breakfast and lunch. Because protein, especially animal protein, eggs, chicken, turkey, beef, fish, lamb, those foods are like a log on a fire. They burn slowly, they burn the fire slowly and stabilize the fire, so they're stabilizing your blood sugar over time. Carbohydrates like breads, chips, cookies, cakes, candy, pop, that's like kindling on the fire. It's like the dried leaves you throw on to get, a big poof. And then what happens? They turn into soot and they're gone, right? So you can start the fire with the with the leaves, but what's going to stabilize it is the logs in the fire. And so that's the protein. So protein 3 times a day. Number 3, pickles or fermented foods. So it's best if you get like a fermented pickle, and there's a brand out there called Bubby's Pickles, and they're fermented and they taste really good, and you just need like a half of one. And you can also get fermented veggies. They have a Wake Robin brand. What do we have? They have pickles, they have carrots, they have green beans, a lot of different ones, which kind of shakes it up a little bit, makes it interesting. But what those fermented foods do is they sort of change the pH of the body in a good way, and they have a great effect on that type of thing, on the sugar cravings. So give that a shot. So it's water, protein, pickles. Can't tell you how many patients over the years have said, oh, I tried that, it was so simple and cheap, and it really worked, Dr. St. John, so thank you. And there are also some supplements that I'll give patients to if those don't work. Okay? Okay, so what I would like to do now is I would like to demonstrate how in a clinic we identify some of these toxicities, organ dysfunction, nutritional deficiencies to handle whatever health condition you're dealing with, like stubborn weight loss. Okay? So, Nina, do you want to be a guinea pig or should I pick someone else? Okay. Okay, so let's say Nina needs to lose some weight. I'm just kidding. So when I test someone, we test, and Nina's a patient. She's been a patient since she's a baby, and her mom's been a patient for 15 years or so, right? So she's like a really healthy kid that, grew up eating properly, taking the right whole food supplements. So anyways, when I'm testing someone, I push on their arm and I feel for resistance. And she's got some nice resistance. Certainly I could, wrestle her down, right? But I'm just feeling for a lock or a barrier in the muscle. Muscle testing is an art and a science. So I have to do it artfully in the correct way every time. And I taught this for 5 years in Clearwater, Florida, the advanced clinical training for this muscle testing procedure. So I taught this, so I really know this well. So let's say she has a nice strong muscle. What I do then, you can rest for a second, is I put my hand over an organ. Let's say we're testing her frontal brain. Okay, let's say she has some energy issue. Okay, so let's say I press on her heart. what I do is I compress the blood supply and the nerve supply to that heart a little bit while I'm testing the muscle. And if that strong muscle weakens, I'm just fake it. If it goes weak, then what happens is we know the arm is not the problem, the heart is stressed in some way. So we go through each part of the brain, the lungs, heart, spleen, stomach, gallbladder, liver, intestines, adrenal glands, thyroid. We go through the whole body, or any parts of the body that someone might have a problem with, their elbow, their knee, their back, whatever it is, and we find for strengths or weaknesses. Then we have sample test files of specific supplements that handle those weaknesses. So then what I'll do is I will hold, let's just make believe that this is a sample test file of fish oil. Okay, fish oil is very important for the heart. They did a study on the heart. You can put your arm down for a second. They did a study on the heart. They took a group of mice, they fed them fish oil. They took another group and it was just a normal diet. Then they shocked their hearts, not to the point where it was, detrimental to them, but they just put some current in their heart. The ones that took the fish oil, they could shock the heart 10 times more before they elicited a response than the control group. So fish oil is very heart protective. So let's say we put fish oil up to her heart that was weak, right? Heart's weak. Fish oil sample, it gets strong. So do you think that fish oil might be good for that person? Yes. Let's say if it goes weak, what does that mean? Well, it just means that this was not the right nutrient. So then maybe I would grab for whole food B vitamins, which are good for the heart. And that was good for this person. Thank you, we're done. So that's how we test. As you can see, it's very personalized and specific to each individual person's needs. The cookie cutter approach, you can get maybe a third of the people well, okay, but you really need, if you want to get a 90% success rate or better, which we get in our clinic for health issues, then you have to have that personalized approach where you're testing the individual, in my opinion, based on my experience. So any questions on the muscle testing and how that works? Because sometimes patients say, well, how does that work? And I say, it works really, really well. But I think I explained it. The body's an electrical circuit. It has electricity to it. So when you're muscle testing, you're compressing the blood supply and nerve supply over a weak organ, it's going to short circuit the entire body. And that's representative of a strong muscle weakening. Okay. And then when you put a sample nutrient next to the heart, for example, if it's weak, the body can easily communicate and pick up what's in that vial. And we have whole food live supplements that we give our patients. So they have tons of life force energy. If you measured it, and this was a special measuring device of energy, you would see a big glow, with the circadian, what's that, cerulean photography?
Oh, yeah.
Or you can take a picture of someone's aura. Well, if you took one of those cameras and you took a picture of some of the supplements that we use, there would be an aura, there would be energy around it. Okay. Whereas if you took a picture of a rock, there would be nothing. So anyways, that's how that works. So when you're putting that supplement next to the organ, you're going to get a strength because the body can easily communicate with that. In the old days, I would put a pill in someone's tongue and they would get a taste of it, which would send a message right to the brain. Everyone can grasp that concept. That makes more logical sense, but it works really well with putting the test file up close as well. Now, how do we determine toxicity in the body? Well, we have other test vials with different heavy metal toxins in them, chemical toxins, we have foods, we have viruses, bacteria, that type of thing in energetic form. And by testing those against the body, we can determine if someone is stressed. Those are stressing out the body as well. So it's very comprehensive. It's almost hard to wrap your mind around. It's so simple. It's complex yet simple. And my old mentor would say it's incommensurable, meaning You just can't wrap your mind around it, but it works, right? So, yeah.
What is the formal name of the applied kinesiology you learned?
So, yeah, so applied kinesiology, I'll explain. So applied kinesiology is muscle testing, and the original version was developed by a chiropractor, Dr. George Goodhart, okay? And every organ it was found is related to a muscle. So your deltoid is related to the lungs, your quadricep is related to the intestines, your biceps related to the stomach. So if you had a weak bicep, you may have a bicep that you strain, but you may have a stomach problem. Okay? If you have a stomach problem, you'll almost always have a weak bicep. There's that connection between the organ and the muscle. And then the acupuncture system works around it, and the spine. So it's a very comprehensive approach to treating the body physically. And there is a nutritional component to it. But I took the nutritional component further, and I took a technique called nutrition response testing.
Okay.
And that's what I do in the clinic.
Okay.
It's a form of kinesiology. Everything I just explained about the vials and that testing, that's applied kinesiology. I was trained in 2008. I took the advanced clinical training, so it was a lot of time, money, and investment in that. And then I taught that from 2012 to 2018. And then the company got someone to be down there full time instead of practitioners flying in that wanted to teach it. So I don't do that anymore, but it's called nutrition response testing.
Okay.
Yeah.
It seems close to ART testing. Have you ever heard of that?
Is that active release technique?
I don't know what it
Yeah.
stands for, but it's Dietrich Klinghart's.
Oh, his testing.
He
Yeah,
developed, and it's similar.
it is similar. There are a lot of arm pull down testing procedures where people are touching points and testing, and I've taken quite a few of them. But I've been doing this for 10 years. I've been exposed to a lot of other ones, but I don't need it because I get the results with this.
Mhm.
Yeah.
Well, you're both putting the bacteria, the nutrients, you're putting it on the body.
Right,
Where the other kinesiologists, they just see where you're weak.
right.
That's
And
the
then they find
difference.
find a nutrient for the
exactly.
weakness. We're checking for the toxicities.
Right.
And that's important. So, yeah. And not everyone does have toxicity that shows up. Everyone has some, but sometimes you don't. It's not enough to need something to detox it out of your system. Sometimes just giving the heart fish oil will detox whatever it needs and feed it as well. So, okay. So now we're going to talk about a very key component to weight loss. If you don't do this, in my opinion, you're not going to lose weight, okay? This may not be the only thing to do to lose weight because of these other things that we talked about, right? But if you don't do this, forget it. Let me get it better. Let's hope this purple works good. Okay. So, let's talk about what happens when you eat certain foods. How that equates to losing or gaining weight. Okay? So let's say someone eats a bowl of cereal, some orange juice, a piece of toast, and a donut. Okay, so what is all that?
Yeah.
What kind of foods are those? Carbs, right? Okay, and you just have to realize that carbs and sugar causes fat storage. It's not red meat, egg yolks, and butter that are causing people to gain weight, or dairy. It's just not. And everyone thinks, what? If I eat fat, isn't that going to make me fat? No. 90% of the time, no. So let's say you eat all that. It gets broken down in the stomach, passes into the small intestine, everything gets digested and absorbed into the bloodstream. So here is an artery right here. So that food gets broken down, and all that carbohydrate is basically sugar floating around in the bloodstream. And here's a cell. It has to go into the cell for energy because the cell needs food for energy. It needs some sugar for energy to some degree. So this little bridge allows that sugar to go into the cell, but the cell only needs a certain amount of sugar, okay, for energy. So when you eat that excessive amount of sugar, what's going to happen to the rest of the sugar if the cells have enough energy? It's going to get stored as what? Yeah. That excess sugar is going to get stored as fat. Now, what is this bridge? I'll give you a hint. It's a hormone, and it starts with the letter I. And diabetics lack it.
Oh, insulin.
Insulin. So insulin is a bridge that takes sugar out of the bloodstream into the cell. It lowers blood sugar. So what happens when you eat the standard American diet? Remember the food pyramid, the old food pyramid? Now all of a sudden we have a new food pyramid, right? They basically turned it upside down. And the old food pyramid was developed by the cereal companies to sell more cereal. Because it was like 6 to 9 servings of grains. Well, no. That's not the answer to health. So what happens when you eat that American diet, which so many do, and diabetes is closing in on 10% of the population now. It's probably beyond 10%. I used to say that 5 years ago. Who knows what the stats are now? It's probably 15% of the population or 20. But when you eat this consistently, the pancreas, this sausage-shaped organ, will pump out insulin. Just keeps pumping out this insulin, right? And eventually what's going to happen to the pancreas? Keeps pumping it out, keeps pumping it out, keeps pumping it out, year after year after year. What's going to finally happen? It's going to get stronger, or it's going to peter out? Yeah, it's going to weaken. It's going to stop producing the insulin. When it stops producing the insulin, there's no bridge to put sugar into the cell. So what happens? You get high blood sugar. You go to the doctor, they take your blood work, and your glucose is 300. And they say, you have diabetes. And you ask your doctor, well, how could that happen? And they said, well, it's just part of life. It's just part of age. So we're going to put you on insulin, and you'll just have to count your calories and go to the dietitian who doesn't know anything and not help you. Okay, I'm being facetious, but that's kind of how it is. So it can be reversed, okay? Especially if you get it quick. So all that sugar and carbohydrate causes insulin to be released, which causes fat storage. Another thing it causes is inflammation in the body. Another thing it causes is the arteries to become thicker and less pliable, which can increase blood pressure. It stimulates adrenaline-like hormones, which is not good for the body because it can be destructive to the body. You know, when your body's in a crisis situation, adrenaline gets released, you handle the crisis, then everything calms down. But if it's constantly being pumped out, that's destructive to the body. It'll break the body down. So the takeaway here, let's just summarize here. When you eat too much sugar and starch, it causes insulin to be released, which causes fat storage. So how do you lose weight? You eat foods that don't stimulate insulin, because insulin causes fat storage. What foods are those? Fish, chicken, eggs, beef, butter, oils, leafy greens, the lower sugar carbohydrates, and the lower glycemic index fruits that don't stimulate your blood sugar. The glycemic index is this measurement of how much of food causes sugar to be released in your body. You don't want to eat foods that have a high glycemic index. You want to eat foods that have a low glycemic index. Berries, strawberries, blueberries, raspberries, blackberries, those are the lower carbohydrate fruits. And then grapefruit is also one that would be good. Okay. So as a rule, it's good to keep your carbohydrates. I'm having problems here. Let's see if this one works. 75 grams of carbs or less per day is really an ideal amount of carbohydrates, because that's going to limit the insulin from being released in your body, and it's going to just help the body start to cause fat burning. Okay? So how many grams a day? 75. 75. So let's talk about that. So if you eat 2 pieces of bread, that's about 30 grams. If you eat a banana, that's about 25. And if you eat an apple, that's about 25. So we're close, just eating those things, we're close to 75, okay? So you have to modify your diet. And I work with people, I have them fill out food logs, and we work with them over time. So the first thing I do when I work with a patient, I say, all right, write down your food. I don't even tell them what to do. I just say, write down your food, bring it to me. You know, don't fib, just write it down. I'm not gonna scold you or yell at you. I wanna see what your baseline is. You know, so if they're at 200 grams of carbs, then we have to work down gradually. So it's gonna take them a little longer to lose weight, but we have to change this eating habit. This isn't a diet, this is a lifestyle. And when you go slowly and work your way down, it's way better for the patient. It's, you know, we're so used to, oh, I want to lose 30 pounds in 30 days. Well, this is not, I'm not a quick fix doc. I mean, I get good results, and I'm in a hurry, I'm impatient, I like to get people well as quickly as possible, but there's my idea of how fast someone heals, there's the patient's idea, and then there's the patient's body. And who wins? The patient's body. So you gotta respect the body. It knows what it needs and what it wants, and you can't push the river sometimes. So I work with them over time, and to really change your eating habits, you're talking 6 to 9 months of close monitoring of your diet. Logging your food is very important, in my opinion, because you really see what you're eating, and it just holds you accountable. You know, everyone needs a coach. You know, like, you know, I go to the gym and I pay a membership, or it's money. You know, you put money down, that motivates you too. So like, I go to the gym because I'm paying money every month, and I think, oh gosh, I only went once this week. I gotta get my butt in gear and get over there, or I'm gonna, you know, not get my money's worth, or you know what I mean.
Yeah.
Whatever your motivation is, but I think when you do something like filling out a food log, I just found it's such a magical experience for the patient. Because they think, oh my gosh, that's how I eat. And then after a week, we'll follow up with them, and I'll look at their diet, and I'll say, well, here's what I would like you to do. Here's what you're doing well. Here's what we need to change. Which of these things can you change easily? And they can say, oh, well, I can cut that out and that out. You know, and boom, that's like 40 grams of carbs right there. And they can just change it with some other low-carb food. Sometimes it's more difficult than that, but sometimes it's easy. You know, it just depends on the case. It depends on how many sugar cravings you have. It depends on a lot of things, your willpower. But we like to try and take the willpower out of it, because you can't make a change using willpower long term. You can grin and bear it for 3 weeks. It's more of you need discipline. Like when you write down the food log, eventually those carbs are going to come down, because you're going to say, well, I'm writing this down. I mean, I'm doing this because I want to get better, so it keeps you in the game. So 75 grams. Does that make sense? Okay, any questions on that? Someone ask a question, please.
I have one.
Okay.
We never heard of fatty liver disease like we do today. Does that process that you described cause it?
I would say it's the sole cause.
Yeah.
Type 2 diabetes, fatty liver, it all goes hand in hand.
Wow.
Yeah. So the liver will get fatty and congested as a byproduct of too much sugar and starch. Yes, very much so.
Is honey considered sugar or just processed sugars?
Honey is considered sugar. It's quote a healthy sugar because it has some mineral content, but when you're talking weight loss, you have to count that, because those things add up quickly. You know, like a tablespoon of honey is like, I don't know, 30 grams of carbs or something like that. It sneaks up on you.
Okay.
Same with maple syrup. So you can be eating, yeah, you think you're eating healthy, but sugar is sugar. When it comes to weight loss and insulin, whatever's going to stimulate insulin to be released is going to cause stubborn fat issues. Okay, whether it's table sugar in a Twix bar or it's the perfect Manuka honey from the island of whatever, you know what I mean? That's much healthier, but still it's sugar. Yeah. Yeah. So when I'm working with someone with weight, I'm looking at the carbohydrates, we're filling out a food log, and we're probably detoxing some heavy metals or chemicals that they've been exposed to. I'll give you another little pearl of wisdom. Sometimes the body will have these things called biofilms in them. Biofilms is like this film that certain bacteria in the body will produce to protect themselves, so the immune system can't get to it. And sometimes those biofilms will cause stubborn weight loss or prevent it. And there's a really good product that I have that oftentimes can be a game changer with weight loss, if it's what you have. And I muscle test that. If you don't, then it's not for you. But biofilms just think of like a film over like the wall of your stomach or the wall of your intestine. And there's like yeast or bacteria hiding out in there, creating colonies and creating problems in the body. So this product will kill and get that biofilm out of your system, so then the immune system can properly get rid of that bacteria or candida or fungus or whatever it is. So that's another thing that sometimes can cause problems. And I think it's called Biofilm Pro Balance from Standard Process is what that product is. It has garlic and kale and some other special prebiotics and probiotics in it. Okay, so we covered sugar, we covered insulin, we covered the diet. Does anyone have any other questions about weight loss before we kind of wrap up here? Sure.
Does it matter when you eat? You know, everybody says you should.
Yeah, that's a good, yeah. You know, there's 101 different methods of losing weight out there, right? You've heard a lot of them, but she's asking, does it matter when you eat? Or there's something called intermittent fasting, and that is one of those things that I may go to if someone has stubborn weight loss. So if someone's eating 3 meals a day, breakfast, lunch, dinner, maybe a little protein before bed, and they're keeping their carbs down, and they're doing all the right things, we have their thyroid working well, maybe their adrenals are working well with some extra supplements, and they're not losing weight, then I might say, okay, I want you to skip breakfast 3 times a week, and eat dinner at 6 or 7 o'clock, and don't eat till noon the next day. What that does is it sort of puts a curveball into your metabolism, and it can help your blood sugar stabilize over time. There's a lot to be said about fasting, and there's a lot of health benefits from fasting too. That's like a whole other topic, but that can be something that you can apply, to if you're plateauing or you just need, another solution to start losing weight. Yeah.
But then it's confusing because then you have people that don't eat all day and they just have dinner, and that I'm always reading you're storing.
Yeah.
Because your brain thinks you're not getting more food.
Yeah.
And it's storing it.
Yeah.
So what is the difference between intermittent fasting?
Sure. So when you intermittent fast, you have to change it up. If someone eats just dinner every day, they're intermittent fasting basically, but they can't lose weight. Well, those people, maybe they have a blood sugar issue to the point where we need to feed them protein throughout the day to take stress off the body because it's too stressful for them. Maybe not eating and intermittent fasting is too stressful for their adrenal glands or stress glands, and they're pumping out cortisol, which is cortisol causes midsection weight gain, causes fat storage. So it could be a problem they can have a problem like that with cortisol and blood sugar. So yeah, you know, it's tough. There isn't a one size fits all.
Mm-hmm.
You know, there just isn't.
So in an ideal world, would you say that we should be having 3 meals a day?
I don't think it really matters if you're healthy. You know what I mean? Because there's a school of thought that says, well, back in the day, you know, people were just out, and then when there was food available, they would eat it. But they didn't have all these other things to contend with. They didn't have pesticides and pollution and electromagnetic frequencies from cell phones. They didn't have all these things to contend with, right? It was just they had maybe 12 toxins, and they had to get clean water and clean food, or that was their problem, right? Or they'd get an infection because they'd get cold and chilled in the winter. So I just think if you're healthy, whether you eat 3 times a day, the body sort of will know what to do. The body has an innate intelligence. When you have good health, you'll eat when you're supposed to eat, and you'll do just fine. When you have a lot of problems and stored toxins in the body, then you have to sort it all out. And you have to use a lot of different tools. And so, you know, a licensed healthcare practitioner with experience will be able to sort that out. That has a lot of experience, like I do. You know, I've been doing this 25 years, and I see a lot of different conditions from A to Z. And after a while, you see the patterns, and you just, like anyone, you just know what to do. You know, like you guys all have a certain skill, and you know what to do. Where if I went in and someone does needle point, I wouldn't know how to, you know, thread the needle. But you would be, and you'd be, you know, halfway done with your needle point, and I'd be like still trying to trying to thread that needle, you know. So, it's not, weight loss is not a run-of-the-mill easy thing to correct anymore. It's a pandemic. It's a problem. And don't think you're going to go take some medication and that's going to be the answer, because if you do that, you're losing 2/3 of muscle and 1/3 fat. So what do you call it? What's it? GLP, yeah, what's the name of that? Ozempic, yeah.
Yeah.
What's that song they have? It's a song like from another song, and I forget. Anyways, it's funny. But Ozempic is everywhere, right? You're gonna lose mostly muscle, and it makes you look gaunt. It could cause projectile vomiting. It's a new drug, and I think it's scary. I would not mess with that.
Or blindness. People are going blind from it.
Oh, I didn't even hear that one.
Yeah.
People are going blind? Wow.
Yeah, they're losing their eyesight.
Jeez.
It's a paralysis of the intestinal.
Yeah. So, yeah, it's better to find someone that has some experience with this, and you just have to be patient. So, I can't say I love weight loss cases, because you have to really educate someone. You know, people come and they have these expectations, and maybe you will lose weight quickly, you know, crossing my fingers, but if not, then we have to sort it out. You know, there's emotional issues that are connected on some level. Sometimes people don't want to have a hard time losing weight because it's like a protective device. I mean, there's so many different factors involved. I don't really deal with a lot of that. I do use a technique called neuroemotional technique, which I talked about a couple of weeks ago, where you can narrow down some emotions related to different acupuncture pathways, like the liver's related to anger, the gallbladder's related to resentment, the heart's related to certain things, etc., etc. And you can sort that out a little bit. That's for another topic. Maybe I'll do a lecture on that sometime. But it is a component. But I would say the majority of the time, if someone gets their nutrition in check and eats properly, and we get the toxicity down, those emotions are going to get processed through the process of changing your diet and your body releasing toxins and that type of thing, you know. Because along with those toxins, there's stored emotions too, oftentimes. Okay? You know, healing is not linear. Healing is different for there are patterns, but healing is different for a lot of people. And that's where the personalized approach comes in. And I just don't know how to get around that. You know, I would love to say, if everyone, you know, I would love to have some technique where everyone could just do that. I'd be rich, right? Because you could just say, all right, take this, and this take this protocol, eat this food, and you're going to lose weight. There are a lot of people claiming that out there, but I would say they probably get a 20-30% result. Which maybe that's not bad, but I don't feel comfortable with that. I just need to, I don't know how MDs do it, you know. Can you imagine being a medical doctor and, well, I just get so many patients that have, the medical community has failed them and they come to me. And I mean, those folks, they don't have the tools to get the results. And if I'm in an acute situation, send me to an MD that knows what they're doing. If I need a joint replacement, send me to the orthopedic guy, fine, okay? But if I need help with my diabetes, pre-diabetes, or cholesterol, or gut issues, or sinus issues, or energy issues, don't send me to the medical doctor. Send me to some alternative practitioner that knows what they're doing, because it's a nutritional deficiency or it's a toxicity that's causing the health issue. Make sense? Yeah. Okay, so I just want to close up by saying, if anyone that hasn't been a patient, if they want to become a patient, you get a free full evaluation